Hi, it's me again, Mitch, and I'm going to show you the next part of our movement, how we can safely move after our operation. So when it was time to be discharged, my worries was about the operation. I was asking the doctor, Doc, are you sure that the stitches are not going to removed, or it's not going to open up again, the wounds? So I was really worried about it. So he told me about securing an elastic band. So just to minimize the fear and just to reassure or to assure me that everything will be okay, because I felt also a little bit of pain, and then there was uneasiness, and I felt really uncomfortable of that area. So what he advised me was to wrap the breast side with an elastic band. So at that time, I still have the Jackson Pratt. It is like it's like a bag wherein all of the fluids come down. Yeah. So I still had that, and I think I placed it under my panties, the bag, the liquid bag on my panty. And then what he advised me was to make use of an elastic band. So I'm going to show you how how this band can help you with your mobility. Yeah. And I was happy that I did this, because I felt much more secure nga dili siya mag-open, and I can really feel the my chest lifted all the way up. So before, without the band, I was having this posture always down because I felt pain. So I was telling myself to make a hunch on my back. But with this elastic band, my posture has improved. So before I left the hospital, I did the wrapping technique. So I placed, yeah, the band all the way here, and then I tried to wrap it. I tried to wrap, yeah, this way. Not too tight and not too loose, just enough you feel the sensations um, that it's trying to bring your the band close to your chest area. Yeah. So I wrapped it around in this way. So make your own adjustments. And then this way. So you can use a surgical tape to seal the band. Yeah, like this way, like so. There you go. So, so I can feel that's the effect of the band. That's the effect of the band. So my left side is the affected area. So now, if you have the Jackson Pratt or that container for the liquid, you can actually make use of your surgical tape again. You can make use of surgical tape, and then you try to, yeah, let's imagine that this is the Jackson Pratt or the container of the liquid, and then you can make sure that the tube, yeah, the passage of the liquid is secured onto your side. And then also that you can do it this way. And there you go. So there. But this is done, of course, without the shirt, without the pink shirt. Sometimes I ran out of the surgical tape. What I did was I just placed the Jackson Pratt. Imagine that this is the container of the liquid, and then I just put it under my shorts or under my panties like that. And there you go. That's one of the advantage of this elastic band. So the elastic band, I used it when I go to sleep. I put it on, especially on the first few hours. Yeah. So because I was afraid to be moving left side, and that's the affected area. So with the elastic band, I was confident that the stitches are not going to rip apart. Yeah. So that's one thing I did not have a hard time sleeping because I was confident that the elastic band will securely bring the operated area close to each other. So, and every 4 hours, I think, or 2 hours, I have to remove the band. I have to remove it. There you go. Just to release the area. It has to have a circulation. And every time I move, I need to go down to get water, or I need to fix the bed. I always put the elastic band. Okay. So when I did my first movement at home, I had this on, but I had it a little bit wider, murag, I think 6 inches. So if you can get the 6 inches and then you can wrap it around, much better. Okay, so we will be having another video for the full range of motion of that arm. Okay, so hang in there. I'll be with you. Bye. See you later.